afternoon, everyone. Welcome, welcome. Thank you for being here. We'll give you just a couple more minutes and then we will start. We still have some participants dropping in, so please drop a hello, welcome message in the chat room as you join in and settle in. Thank you. Okay, awesome. Welcome again, everyone. Good afternoon. My name is Lois Semede. I serve on the team with a part of the team at Pistis Foundation, and we're pleased to welcome you to our webinar. Our webinar today is on mental health, staying healthy in a recession. And welcome to those of you who are maybe engaging with Pistis Foundation for the first time. We're a not-for-profit organization headquartered in Lagos, and our goal really is to be a model provider of empowerment opportunities to economically challenged persons within our target communities. And we do this in a number of ways. Our goal really is to empower people, and we do this through our health programs, our education programs, and our shelter programs. We're here today because of our health programs, and we generally have two approaches that we use when it comes to our work within the health space. The first one is curative, by providing healthcare, medical outreaches to people. And the second one, which is why we're here today, is preventative. We don't always want to have to get to the stage where we're having to cure mental health or physical health concerns. What can we do to prevent it? And that's really why we're here today, to have these conversations, to empower each and every one of us here, equip us with the skills that we need to be able to have that healthy lifestyle that we want. Can someone just confirm that you can hear me clearly? You can see me, so I'm sure that I'm not speaking to myself. Maybe one of the panelists can confirm that you can hear me.
We can hear you.
Awesome,
hear you,
awesome, great. That's great to hear. Awesome, good. Okay, so like I mentioned today, our topic today is mental health, staying healthy in a recession. And we all know what a recession is, you know, a time when we can feel the pinch of the economy. And I think all of us can attest to feeling that within our current situation and within our country at the moment. The rising cost of living and unemployment are taking a toll on a lot of people, on a lot of Nigerians' mental well-being, and even for some of us here. Depression is beginning to set in when people experience financial strain, job loss, uncertainty about the future, and so many more factors. We can see that depression, anxiety, and some of these other things begin to play a part. The impact of this can vary from one individual to another. You know, we all deal with these things differently, but we find that poor mental health can really cause a reduced ability to cope with these things, with the stress, and can ultimately even begin to lead to physical health problems and strained relationships, amongst many other things. And these are things that we want to take a stab at beginning to prevent before we can get into a case of having to cure, though we're already having to deal with that as well. And that's really why we're here today, to have an opportunity to talk about that. And we have with us two very seasoned professionals who would share from their wealth of expertise with us today. But just before I call them in, just a couple of housekeeping rules. I know that you noticed that you may not be able to speak right now, but that's okay. Our goal is to have an interactive session. So at various points, the facilitators might ask a question or give you an opportunity to ask a question in the course of the session. Please, if they do that, feel free to raise your hand Let's test that out. Can somebody just raise their hand so that we can see your raised hand? Any of the attendees, just raise your hand. Awesome. Okay, I can see one. Any others? Just raise your hand just so we're sure that that works. That's one person doesn't have a special, awesome. So once that happens, so from the mouth of two witnesses, we can see that that works. Once that three, perfect. We'll pick on someone and ask you to talk. Please feel free to ask any questions you might have or contribute at that point in the session. And so that will be one way that we can keep it interactive. We would also repeat this process at the end for anyone who has questions that they would want to ask and would want to ask that themselves. Please feel free to raise your hands. We'll ask you to unmute yourself, and then you can go straight up and speak, ask your questions, answer whatever questions in the course of the session. However, as we go along, if you want to contribute, maybe the speaker may not directing you want to have something to ask. We have a box to put something you put will be able to get a sense of that. So please feel free to do that. If, however, you have questions in the course of the session and you don't necessarily want to wait till the end, or you're happy to just type it in as you remember, we have our Q&A box there. Please feel free to put your questions in there. You have the option of having your name or putting that in anonymously. You can use that. So the chat box is for contributions and the Q&A box is for questions. Let's take that again. Chat box for contributions, Q&A box for questions, so that the panelists can take on those questions. A couple of things though, I would advise that when you put your question, also indicate the panelists that you would like to answer that question. It just makes it easier for us to, that panelist to address your question at the end. So your question and the name of the panelist, or if you want to ask a question right at the end verbally, rather than typing it in, you have the option to do that. I hope that that's clear. Please put something in the chat box if we understand the house rules for today's webinar. Just say yes, not clear, and I'll go over them again. I'll give you 1 minute to get feedback. Can we confirm we understand? The chat box is for the chat box for questions. Clear, thank you. Awesome. Chat box for contributions, Q&A for questions, and please let's include the name of the person that we would like to answer our questions. Okay, so now we'll be going into the meat of today. Our first speaker, I'm about to call on our first speaker, Nonye Ukwuoma, who is the lead consultant at 360 Psych. Nonye is a Lagos-based therapist with over 13 years experience in behavioral research. She holds a master's degree in clinical psychology and another master's degree in public health, and she's currently working on her doctorate. She holds diplomas in cognitive behavior therapy, relationship counseling with multiple local and international recognized trainings and certifications. Nonye is currently, as I mentioned, the lead consultant and founder of 360 Psych, an award-winning mental health organization headquartered in Lagos, and who is partnering with us today to bring this webinar to you. They have multiple branches in other states in Nigeria as well, and they offer services available 24 hours of the day, 7 days of the week, which is so important, especially when we're talking about mental health issues. She consults and affiliates with various local and international hospitals, organizations, and NGOs, such as ours, and she is a host to an online show, Understanding Crazy. This is a platform that discusses all mental health related topics in languages that you can understand. Nonye is a prolific writer, trainer, and researcher. So please join me as we put our hands together. Let's give a virtual hand clap and welcome Nonye Ukwuoma to today's webinar session.
Thank you so much, Lois. Thank you so much. So I'm really glad to be on this presentation with Pisces Foundation. Coincidentally, just about a few days before I got the call to be on this presentation, I was having a conversation with my sister, and she was asking me, how am I coping How am I managing? And I have to tell her, the truth is, at this point, the therapist needs a therapist because it's like every day new wahala. There's something up, we don't know what to expect the next day. You'd wake up in the morning not really sure of how things would go because there could be just one news that would spoil our entire day. And why I'm painting this picture is to let us all know that we are in this together. Everybody and anyone you know has felt the pain or the hurt or one time or the other as regards what we are currently going through, which is a recession. So before I go into the crust of today, I like to paint a more individualistic opinion of what we are talking about. You know, when we talk about recession, we think it's one broad concept that really doesn't affect us as persons. So I'll just talk about a story about Amaka and Fisayo. If you're Amaka or Fisayo on this call, this is not about you, just an ambiguous name. But it's talking about an actual story of two people. So Amaka tried over this last few years, 5 years particularly, to try and get a tech degree. So she had been working in sales and she decided that tech was the in thing for her to get into. So she went on and she learned a tech skill. And she got a job, which was good, which was paying well. And she continued on that job until last year when she was called in and she was told that they would have to let her go. Not only did they let her go, they let 90% of the markets, 90% of the persons in that industry, in that company go. Now, Amaka saying that things were difficult and she tried to get another one. Of course, she got one or two side gigs, but it was hard. Then she went to Feishayo to ask, okay, Feishayo, my guy, please help me with money. Feishayo said, nah, you see, I've been struggling this period. My wife's business that was providing or supporting at the beginning is currently down. People do not have the spending power to buy anymore. So we are dependent on my income. It's not as if the business or the company I work with are paying so much. So Feishayo on his own really cannot help. This is the reality of a lot of us. And when I say us, I'm not saying people, I'm saying us because it affects us. This is the reality of a lot of us currently, irrespective of where we are, especially when we're in Nigeria. Now I'm giving a case study of people that had jobs. How about people that were struggling before now? Now the struggle is even stronger. And this is why when we're talking about all these things, new day, new problem, new week, new challenges, all these things coming together can lead to a more serious mental health challenge in future. I so much like what Lois mentioned as regards a preventive method when it comes to health with Pistis Foundation, because while everybody is going through this, not everybody will have a mental health challenge as a result of what is going on. So it's important for us to understand that small amounts here and there can come together to cause a more serious mental health challenge in the future. And the thing is, if we do not manage the stress of what is going on now in bits, and this stress, we're talking about stress as regards money, worry. You know, money is not just the absence of it, but also the fear of not having it, even if you do. We are talking about stress related to sleep disturbance, thinking about the dollar rate, everything happening could cause us to lose sleep. We're talking about stress reflected in stress eating. A lot of us are emotionally eating right now, in the sense that once we feel some certain emotions, we want to go in and take food. We don't exercise. Of course, we're trying to make ends meet, so we want to go all about. Some of us are beginning to use substances. Maybe we're starting to use substances or using it a little bit more than how we used to it before now. So all these small things coming together can lead to a serious mental health concern in future. So I'll just not go into what a recession is. But when I was trying to understand recession goes beyond just the company. It goes like a company, an industry, different people going through stress, going through downtown at the same time. And this period is prolonged and is causing a negative effect on the economy. just as we are seeing right now. So I'm not going to delve right into what recession is because we can feel it. Our spending power is reducing. We are using more money to buy very little things. We are finding it difficult to get more things than we would have in the past. Now, this is a very interesting fact. If you look, researchers have come together and they've asked themselves the question, at what times does mental health challenges peak? Like what times do we see more people with mental health conditions? And looking at the issues way back as far as you can think that we've had recession. Research has consistently shown that recessions are associated with poor mental health well-being. It has also been associated with increased rates of mental health conditions, particularly depression and anxiety. It has also shown that during recessions, more people are more likely to abuse substances. And when I'm saying substances, I'm referring to alcohol, I'm referring to marijuana, I'm referring to cocaine. Those are the more difficult ones, but marijuana. I'm also referring to painkillers that nobody prescribed that we take. Those are also related to substance-related challenges. Now, suicidal behaviors, self-harm behaviors, not just the thought of killing ourselves, but the thought of harming ourselves as increases during this period. So if we look at the evidence from research also, suicide is on the, like, it's very high right now. We've not seen it this high ever. So this is all related to the current condition in which we are going through, which is recession. So now that we've talked about what recession is, let's look at health. We have different dimensions of health, and I'm not going to talk about the other dimensions. I'm going to focus on the one dimension that we're here to talk about, the mental health. Each of these dimensions influences each other. So when we talk about health, we are talking about a state of complete physical, mental, and social well-being, and not just the absence of a disease. While we're talking about these three, we understand the spiritual health as well. So these four areas are very critical when it comes to our health. So let's focus more on the crux of today, which is mental health. Mental health is a state of well-being in which an individual, in which Nonye realizes our capability, our own capability, and can cope with the normal stresses of life. This means that we understand that stress is going to come up. But how well can we cope with those stresses? And how well can we work productively and fruitfully in order to make a contribution to our community? Our community in this case is our family. Our community is also our immediate community, the compound, the streets, the estates that we belong in, the school we belong in. This is our community. So if we're talking about mental health, we're talking about that state of well-being to be able to function in these different areas while we are managing stress, while we are realizing our potentials, and while we're coping with the many stresses of life. Mental health involves various dimensions. So when we're talking about mental health, we're talking about how we think. We're talking about how we feel. That's our emotion. We're talking about behavioral, social well-being, how we act with other people, how we think, how we feel, how we act. So that is what mental health encompasses. So now that we've talked about mental health, what are really mental health conditions? So if we look at the previous slide, we are talking about what we characterize as unhealthy mental health, our ability to manage normal stresses and all that. Now, when this doesn't go as it should, there are certain conditions that develop that affect us in different ways. Different ways in the sense that just as our faces differ, mental health conditions differ. Now, I want to say this now, while we're having this presentation and we're showing us the broad category mental health conditions that can develop. It doesn't automatically provide a diagnosis for if we meet some of the criteria, or we want to diagnose other people and put them on the label and say, you are, I've seen a lot of people do this, which is totally wrong. They use mental health, like really serious mental health conditions, to throw shades. You are OCD, you are bipolar, like these are serious health conditions. So while we are talking about this, is so that we can understand that there are different conditions, and when we feel certain ways, it's important for us to get professional help, or we get support from our community member. Truth is, not all mental health situations would need to see a professional, but you understand that this is something we need to manage. Remember our initial conversation, little amount of stress. So we need to be able to understand it and know how we can manage. Examples of mental health condition: OCD, obsessive compulsive disorder. OCD goes beyond the need to keep things arranged or they need to be knit. It's an obsessive, meaning that there is a constant thought in our mind telling us that something needs to be a certain way, and that thought keeps reoccurring, can shake up until we do certain actions. For example, until we put things in certain way, or go to certain places, or check our door multiple times. People do these things, doesn't classify them as OCD. Someone that likes things neat doesn't classify them as OCD. It's more than that. So it's important for us to seek professional opinions before we come to a decision or put any label on ourselves or other people. There are others. There is panic. Panic is closely related to anxiety, constant worry. We find ourselves beginning to palpitate. We are constantly worried. We can't stay still. We are always worried. And there is also eating disorders, bulimia, where we eat and we throw up, or anorexia, where we try to avoid food, thinking that we are big even when we're not. There's also binge eating, when we eat a lot without a lot more than we need to, because it also falls close to emotional eating. We just keep eating. There's also night eating syndrome, where we find ourselves eating at night. There are addictions, different forms of addiction. Social media, it is not yet not on the diagnostic criteria, but it should be considered because a lot of us are beginning to get addicted to it. There is, of course, alcohol addiction and the rest of them. So these are various mental health conditions, and it's important, if you feel something, you say something, so you can get medical opinion to manage. Now, mental health conditions varies. It varies from low to high. So if, for example, I have OCD symptoms, it could be low or it could be high. So because I do have OCD symptoms, doesn't automatically mean that I'm on the very high end. It could be just be that I'm on the low end, and with those low to medium spaces, it can be managed with an effective support system, which we'll talk about just before the end of this presentation. So reason why we are talking about this thing is it's not just to tell us that these challenges exist. It is telling us that these challenges exist so we can be aware of them and so we can do something about them. Because the importance of mental health cannot be overemphasized. There are a lot of benefits that comes with a very conducive mental health, because our mental health affects everything we can possibly think of. So I've had people that have complained consistently about physical pain. And this physical pain is unexplained. Unexplained physical pain is, I did not do anything, I did not fall down, I did not, or maybe I did fall down, but the pain is really a lot, and there's no medical reason to why I should feel this much pain. Or I'm having back pain and I don't know why. These unexplained physical conditions are mostly linked, can be linked, not mostly linked, to our mental health states. You know, there are some times when some people would say that I'm on the big side, right? I'm fat. But in reality, you are not. And based on that, they could start self-harming, they could starve themselves, they could harm themselves. These are ways in which mental health affects everything that we do. Our state of mental health sometimes influences how our so if our mental health state is not the best, it could affect how we connect. Also, it affects our, I don't want to break it down, but it kind of affects everything. It affects how we interact with other people. Most times when we are not in the best mental space, sometimes we isolate, sometimes we are all out, and even to all the space that doesn't benefit us. Mental health also helps us cope with stresses of life. The thing about stress in life is it would be nice, right? If nobody has any stress, if we are just like everybody just has just being high-fiving and doing rest. Manage the stress. And that is why our mental health is important. We also need a very good mental health to be able to make healthy choices. Our decision to wake up in the morning, make our bed, make a decision to go out to work, make a decision to be productive at work, make a decision to not fight anybody in the bus or legal traffic. Those decisions, right, even when offenders, those decisions, make decisions not to be aggressive or to snap at our children, those decisions, healthy choices, is because of the state of our mental health. And it's important for us to be able to manage them. The state of our mental health also influences our physical health. I'll give you an example. A recent, it was not a research, it was an actual person. The person was sick with a medical condition that it was very difficult. It's a medical condition that was very difficult for them to sleep without pain. In the sense that if they sleep 30 minutes, they wake up because of the kind of pain they are experiencing. And the person took it upon himself and said, nah, I need to do something different. And the person started focusing on mental health. And they made a decision that I'm going to take out time to laugh for at least 30 minutes. I'm going to take out time to manage stress. I'm going to take out time to manage how I think. And the thing is, after that, the person realized that and this kept as they went on. They even lived longer than how the doctors anticipated that they would live based on the mental health condition, based on physical health condition they were experiencing. So they got to live longer than that. That's because they focused on their mental health. Mental health helps us build good relationships. And when we say relationships, we are talking about all kinds of relationships. Romantic relationship with our spouse or people that we are in relationships with. If we are not in the best space, it's going to be difficult maintaining a good mental space, a good relationship. I'll give an example. There is what we call an attachment style in psychology. The attachment style is a broad way in which we try to describe how people attach to other people. There are different types of attachment style. One of them is an anxious attachment style, in the sense that the person constantly has these feelings that they are probably not good enough, or probably the other person is going to go away. And this is reflective in their behavior, thereby causing a strain in the relationship. There is another attachment style we call avoidance, in the sense that the person believes that, nah, I don't think I need to put in effort into this. I'm just going to be aloof. and this causes them to withdraw from emotional intimacy, which affects the quality of a relationship. Remember what here is not relationships. We are saying good relationships, quality relationships. That's just one way in which the state of our mental health can influence our relationships. Also, if I'm depressed, it's going to be difficult for me to have a good working relationship with a partner because I am not in the best space. I'm going to find myself leaving tasks unfinished, or I'm doing things, or I'm snapping on being irritable. It's going to affect the quality of the relationship. I'm just going to go to the last one, which is realizing our full potential. As individuals, we're all unique, and we can do so much more than most of us realize that we can do. So this good mental health helps us realize our full potential, and not just realizing our potential, gives us an opportunity to actualize that potential. I'll give an example. If I am struggling with imposter syndrome, it's going to be quite difficult for me to go into my job and try and achieve all that I can because I feel I am an imposter on that career. And also, it's going to kind of affect how I also relate at the job, because if there's an opportunity for me to speak, I know the answer, but I say, "Nah, I'm not supposed to be," then I don't talk. And then what does it do? It possibly limits, because it's not automatic, possibly limits how well I grow in that organization. Or if I'm struggling with anxiety, it's going to be difficult for me to speak up in a crowd and talk about what I believe or what I know is true, which could probably limit my opportunity because of different mental health states. Now, I'm not saying conditions, mental health states are totally different, right? We could be in a very uneasy mental health state without having a diagnosable mental health condition. They are different. So our mental health states may be one filled with a lot of worry, a lot of sadness, but doesn't meet the criteria for a diagnosis for anxiety or depression. So stick to that, because most of us fall under that category, falling into the one of an actual mental health diagnosis. If we do not manage these different areas, if we do not manage our mental health space, there is a very high chance that if we are not going to get to our full potential, or even get to as much as we can at every given time. So while we've talked about this and we've tried to down on the different areas, the importance, what is mental health, what is recession, we're going to go to the major thing: what do we do about it? Which my colleague Priscilla is going to take it from there. What do we do about all this? How do we improve our mental health states during this period of a recession? So I'll hand over to you, Priscilla. Thank you so much.
Thank you so much, Nonye. That was so helpful. Please, can we just give her a virtual hand clap and just put our hands together for such a really helpful session. There's so much about mental health that we don't talk about enough. Just having you go through all of those things that are important, and how those, taking care of our mental health, the impact it can have on the various aspects of our lives, on our relationships, on our work, on our community. All of those things are so important. And thank you for, what you said at the beginning, that yes, all of us, yes, are experiencing this economic strain and economic stress, but not everyone would necessarily have a mental health breakdown. And how, there's a spectrum from the low to the high, and how important it is for us to identify where we are and do the necessary steps that we need to take to ensure that we maintain our mental health. And we're looking forward to hearing more from our next speaker as she takes us through some of the things that would also enable us and help us to be able to make sure that we stay on the lower part of the spectrum, where we're able to manage our mental health and enjoy these benefits of having a healthy mental health state. So please join me in Well, before you put your hands together, let me just briefly introduce Dr. Priscilla Dogo Jackson, an experienced and passionate clinical psychologist and relationship expert with demonstrated history of working within the mental health industry for years. She's skilled at evaluating and managing diverse psychological needs areas, as well as helping clients through the journey of better self-understanding, finding solutions to emotional, social, behavioral, and mental health challenges. Over the years, Dr. Priscilla has worked with different organizations and served at different capacities, including rehabilitation and relapse prevention, inpatient and outpatient services, training people, amongst other things. Um, Priscilla holds a master's degree in clinical psychology and currently works as a clinical psychologist with 360 Psych, our partners for this event, a mental health care service provider. Before I call Dr. Priscilla on, just one more reminder that please use the chat box for your comments. Please use the Q&A box for your questions, indicating who you'd like to answer the questions. And please join me in putting our hands together for Dr. Priscilla as she takes the stage.
Okay, thank you very much. Good afternoon, everyone. I'm really glad to be here on this webinar. Thank you so much, Dr. Nonye, for making my work easier. So quickly, straight to my portion of the presentation. I'll be looking at how we can manage our mental health so that we don't end up having mental health illnesses or challenges. Okay, like Dr. Nonye rightly mentioned, we go through a lot of things. We all go through a lot of things. I started smiling when she said that we all go through a lot of things. I've had my own fair share. So when I say we, I am included in all of this, right? So quickly, there are several things we can do that would help us maintain wellness in terms of our mental well-being. And also there are things that if we fail to do them, we are becoming or setting ourselves on the trail of becoming or experiencing some of the symptoms or even becoming ill mentally. All right. So join me as I go through the tips. So number one, the stories we tell ourselves. Now, the things you tell yourself sometimes has a way of affecting how you feel, how you view life, how you view the things that are happening around you, telling yourself things that are not true. For instance, when you look at yourself and call yourself particular names that are demeaning, names that would bring you sadness, names that will make you feel less of yourself. For instance, when you look at yourself and say, I am a loser, before you know, you start behaving like a loser. So even when things begin to improve in and around you, you would not realize it because why? You have told yourself stories about yourself and you're beginning to live that story already. So how do we prevent ourselves from getting to this point? Tell yourself things that will help keep your spirit up in the right place. It would help you keep a positive mindset. Say things about yourself. Make positive confessions about yourself, all right? A typical example is also feeling of hopelessness. Now, when you have a feeling or a belief that things will never get better, the truth is, even when things start to get better, you would not, your body, your mind, your spirit will not connect to that reality because, of course, you have told yourself the wrong stories. So what do we do in this instance? Tell yourself, reassure yourself every day that despite that things are not going on well now in the economy, despite that my finances are not really enough for me to get the things that I need, despite the fact that my job is not as satisfying as it was before, despite all things, keep the belief that things will always get better. So an example of how you might also set, or we might also be setting ourselves up to get down in the line of mental illness is having beliefs that certain things are happening in the economy or in the financial institution, or everything around us is targeted at us, is targeted at hurting us in particular way. So the reality of the recession is affecting everybody. When I say everybody, everybody, both the rich, the poor, the low, the high, the black, the white, the short, the chubby, everyone, including even our young ones, our children. So projecting that the outcome of everything you venture into is going to be negative is another way of not helping yourself in terms of maintaining mental health. So being optimistic as a person in terms of projections will help you stay positive, would help you stay healthier. But on the other hand, if you're always projecting negative, confessing negative, believing the negative, you'll find out that before you know, by the time you just take some minutes or some seconds to think of, oh, the worst things, before you know, your mood will begin to shift from being happy to being sad. And before you know, you emphasize those thought patterns, you are just not helping your mental health to be stable. So if you want a healthy state of mind, you want a healthy state in terms of your mental health and your well-being, you could dwell on the positives, even when things are seemingly not so okay. Keep your mind on the positive. So now there's this idea of taking more responsibilities because of the recession, people taking more jobs, people working 2, 3, 4 jobs so that they can meet the needs of everyone in their lives. I mentioned to someone one time that there can only be one savior of the world, and you cannot even finish meeting your own needs. Talk more of saving other people or meeting the needs of everybody. So it's important that you take out time to rest, understand your body, how much of stress your body can take. Okay, so you should not expose yourself to taking too much responsibilities because you want to have more finances to meet your daily needs, and then making your body go through so much strain, stress, you're anxious about meeting the needs of your family, extended family, friends, impressing other people. You cannot be the savior of the world. So be mindful of your body, be mindful of your health. Take up responsibilities that you can manage. Don't take too much, more than you can handle per time. So another way of maintaining our well-being in terms of the stories that we tell ourselves is having a fixed opinion on what should make you happy, what things should be in place before you're happy. So being flexible, knowing or cope, or knowing how to abase and to abound, knowing how to be happy, staying happy when things are a lot, when you have more than enough, and when you have just small. So your happiness should not be tied to particular things that are in place in excess. So for instance, you should be able to be happy when you just have 1,000 naira in your pocket, and when you should also be happy when you have 1,000,000 naira. So what I'm trying to say is, do not tie your happiness to a particular fixed thing or a particular opinion or a particular standard, so that when these things are not there, just like in the recession, certain things will definitely change. Your joy or your happiness will not be tied to that. So the second point on how to manage our mental health is for us to watch out for early signs. Now, before people begin to come down with mental health conditions or mental health illnesses, they're usually very visible signs. Of course, like Dr. Nonye mentioned, it's not in our place to just sit and then make a list of these signs and symptoms and begin to label people and begin to diagnose them of those illnesses. But it is good that we look out for these signs, so that if we begin to see these signs in our behavior or in our loved ones, we can begin to get necessary help, because early intervention is key for any health issue. All right. So example is when you start checking your symptoms in Google. Now, sometimes when we check out those symptoms in Google, we might see the worst of situation, and then those things can set us up for anxiety. Okay, so frequent or sudden changes of mood. You are happy this moment, you are sad that other moment, without any significant reason for these fluctuations. That could be an early sign of onset of a mental health condition. When you find out that you're beginning to avoid the people you usually would want to be with, you're avoiding the activities that you previously used to enjoy. For instance, if you love to spend time with your spouse and you notice that you're already withdrawing, you are avoiding, and it's becoming a habit, or you love to go to see certain things in nature, or take a walk, and you notice that suddenly the things that make you happy before, the things you love to do, you look forward to doing on a daily, you're no longer looking forward to doing them. And when you do them, you don't derive the joy that you usually would derive in those things. Could be early signs. Okay, persistent negative thoughts. When you realize that on the continuum, you are always thinking of the negative, you're always thinking of the what ifs in the negative perspective. Your mind, your content, the content of your mind is always, oh, what if the negative? What if the negative? You're always thinking, oh, this negative thing is about to happen. It is going to happen. So if the content of your mind is always occupied with negative thoughts or hallucinations, hallucinations can be in different forms, seeing the things that other people can't say they are seeing, feeling what it's not visibly there, or you're hearing what other people can confirm that they are hearing also. So that could be early signs. Another early sign is negligence of personal hygiene or your well-being. So for instance, if you find out that you're not able to take yourself to the bathroom to have your bath for a day, 2 days, and even more, and you don't feel anything wrong with that, it could be an early sign of mental, your mental well-being not being in the right state. All right. So not being able to carry out your daily activities for no tangible reason. You can't place your hands on, why am I not meeting up with my expectations in terms of my work, at home, in school? That's another one. Thinking of self-harm or even actual self-harm. Thinking of, oh, I think I can't take it anymore. I think if I hang myself, this trouble will end. Oh, if I fall into water, this trouble will end. Or if I do, just thinking of self-harm generally. So if you find yourself thinking of these things, this can be early signs. So when certain areas of our life begin to get affected in terms of our work or our relationship, you find out that you're not communicating the way you usually would communicate. Is either you're talking too much, you're talking too little, or you're not even talking, you're becoming withdrawn or isolated. You're not doing the things that you're supposed to do in your workspace, in your workplace, or with your relationship. Thirdly, prioritize self-care. In maintaining well-being, self-care is topmost. All right. So part of the ways we can prioritize ourselves in terms of self-care is getting good sleep. Now, there's a whole lot that we save ourselves from when we get to sleep. The body gets to rest, the brain gets to rest, tissues get that are worn out gets replaced. We get back our energy, we become refreshed, and you see that you start up your day stronger, smarter, and you're able to carry out your activities without so much stress, without fatigue, without so much stress, like I mentioned. So practice and prioritize eating healthily on a budget, because of course, presently we can almost not get the things that we normally get with the amount that would get them before. So we would have to learn how to budget towards eating healthily. Focus on effective ways of managing stress. One of those effective ways is exercising. Okay, you can start with exercising, breaks, working, skipping, and whatever activity you think you can use to exercise your body, and also take up responsibility or tasks that you can manage. Okay, now in part of managing the recession and the troubles that come with it, people tend to engage in certain behaviors that would be detrimental to their mental health and even physical health. And some of this behavior can be increased consumption of alcohol and other substances. So if you want to maintain your well-being in terms of self-care, you can reduce the amount of this consumption, control the level of consumption, and take only medicines that are prescribed by your healthcare professional. So be intentional about connecting with your loved ones. Now, the struggle that comes with the recession is capable of making us feel inadequate, sad, and not sure of what we can do for ourselves and even our loved ones. But if you spend more time with your loved ones, you will get the support that you need to navigate these trying times. I was also mentioning that families should carry their young ones along, because these changes in the economy has a way of affecting what we can provide for even our young ones, so that when they go out there, they are not cajoled into thinking. They are thinking in ways that will make them lose their self-esteem, their self-worth, because they are not being able to bring to school or bring to their peers the things they usually would bring to their peers before. So we could also prioritize our well-being in terms of mental health by limiting the use of social media. Now, that the social media space has a lot being thrown out there that can affect our mental well-being. You get to see people living fake life. And so if you follow closely and believe everything you see on social media, then there's every tendency for you to get depressed, for you to get anxious of the things you're saying. Oh, my friend has gotten XYZ. How come I'm not in that place? Then you start worrying, you start panicking, you things that would be detrimental to your well-being. So one good way of self-care and prioritizing ourselves in terms of health and our hobby, or start something new in order to manage your time, make good use of your time. Because sometimes I realize that when you have too much time, probably maybe you just lost your job and you have too much time on your hands, you begin to take out those times. If you venture into something new, you find out that you have less things to worry about, and then something good would just come out of that hobby or that little thing you just started. And that would also bring up improvements, would help you maintain wellness in terms of your mental health. So in conclusion, I would like to say that our mental health, just like physical health, is very important. You know, when we feel symptoms of fever, malaria, headaches, we'll go to the laboratory, get tests done, and then the doctor or the physician diagnoses and gives us medication. So our mental health is as important as our physical health. When you feel some of these things that we had mentioned above, you see some of these symptoms, instead of waiting until they begin to manifest as full-blown mental health illnesses, you could reach out to any mental health care service provider near you, and you will be glad you did. A word from 360 side: the smart way to better life. Staying healthy during a recession requires mindful choices and prioritization. Remember, good health is an investment that pays off in the long run, providing you with the strength and resilience to overcome the challenges of a recession. It can seem like a battle, but you don't have to go through this battle alone. You should never walk alone in any case, all right? So thank you, and we are grateful that you are here. Thank you so much.
Wow.
So our final note will be an apple a day keep. Yeah, thank you so much.
Yeah, please go ahead.
Thank you. Okay, I was going to say thank you. Yeah, thank you.
You're going to tell us the final note about an apple a day.
Yeah, I was going to say an apple a day keeps the doctor away, and a smile on the face keeps the wrinkles away. But if you have a need to see a therapist, please reach out to 360 Psych. We're very able and available to help you in ways that you would need us to. Thank you so much. Thank you for having me.
Awesome, awesome, awesome. Thank you so much, Dr. Priscilla. Thank you for that amazing session to just, guide us and give us some ideas on how to ensure that we manage our mental health. We'll take those three major things with us to manage the stories we tell ourselves. It's so important what we're feeding our minds with and what we believe about ourselves. So we'll be sure to make sure to remember that and to look out for those early signs. Thank you for listing them out, and not just in ourselves, but in those around us, our family, our friends, our colleagues. So being able to look out for ourselves and each other as well, observe them and take action early, and prioritize self-care. You know that that's not an easy one with the busyness of life and everything, but making that conscious effort to get the rest that we need to pamper ourselves when we can. Just prioritize our self-care is so important. Thank you so much for that. We already have the Q&A buzzing with questions. So I think we will just hop right into our Q&A. We have some questions ready for Dr. Nonye. So let's start with Conrad's question, because that's just right in the middle where my eyes are. Dr. Nonye, I have been diagnosed twice of having insomnia, depression, and anxiety. This sessions are real sessions for us, and I thank you so much for being willing to be able to speak to these concerns as well. But I still feel isolated and depressed despite my positive intentions. Though lately I faced two scenarios of toxicity amongst close work colleagues. I joined the church unit and I exercise. What can I do more to be in a good place mentally? So Dr. Nonye, if you can take us on that first question, please.
Thank you. Thank you so much, Lois. And thank you, Conrad, for this question. So if I was to speak to you directly, I would have asked if you're currently on any medication to help with insomnia, depression, and anxiety. Because usually in mental health conditions, we try to look for comorbid factors. So what I can see here is more than one condition is coming together. So we have depression and we have anxiety. So I would have asked if you're currently on any to help with that. So one thing we understand with depression and anxiety, it has to do mostly with the kind of things we tell ourselves, our thought processes. So first of all, Conrad, and to every other person that may be struggling with this, we need to sit down and do an introspection. What are the stories? Just as Priscilla had mentioned, what are the stories that I'm telling? What are they? We need to sit down with them and write those stories out, because we need to challenge them. Because if we feel isolated, it's probably that there is something you're telling yourself that makes you feel isolated in a group of people that you are supposed to be connected with. I'll give you random examples. If I am in a group of people and I do not feel connected, it's possibly because maybe I feel that I am not supposed to be among this set of people. Maybe I am of lower standard or I am of higher standard than these people. So even while I'm around them, because I just have to, I may not still feel as connected. I could also feel that they may be judging me, even if they're all smiling. They may have some things about me that they know about and they are judging me based on that. And that is why I'm feeling this way. So I think the first thing is, let's look into ourselves and ask ourselves, what are the stories we are telling ourselves that is making us feel this way? And we take down the story by writing. Why do I say writing? Averagely, we have about 6,000 thoughts in our head per day. That is a lot of thoughts. A lot of things come and go from our mind. So if we don't write them down, things has a way of just jumbling of our memory and our thoughts. So that's the first thing we can do. Now, the second thing we can do, while in these groups, we may need to become a little bit more intentional. I'll give you a trick that works. There's this hormone we have, everybody does have it. It's called oxytocin. This particular hormone is released majorly when this particular hormone is responsible when a mother and a child bonds. So one thing that can help you feel less isolated is to become more intentional with how you relate to the people in this group that you've joined. For example, if it's not going to be inappropriate, of course, you have to look for people that are appropriate within that. You could hold hands. That helps you feel more connected. Now, when we do that, it releases this hormone that makes us feel more connected with those people. We could hug. Like we found out in research that keeping not just the side hugs that we do, like hugging somebody, especially when we are in a mental space that is not the best, it releases this hormone that makes us feel connected and also makes us feel good. So if you can stay there for about 5 to 10 seconds, it can help us feel less isolated. Now, another thing we can do is to have more conversations, be more vulnerable. Now, this is a bit skeptical because already maybe we are telling ourselves stories that's judging ourselves. So it can be a bit difficult to be vulnerable to them. I've had people that have shared within groups and they eventually felt that I've shared too much, I've exposed myself, and they feel a little bit worse off than when they. So it's a bit dicey. And that's why I still go back to the first point. What are the stories that we are telling ourselves? What are the stories? It can help us figure out a way that can help us become more vulnerable to people. So when we become more vulnerable to people, we tend to be more connected with them and less isolated. So I see you mentioned that there's toxicity at work among close work colleagues. Has this always been the case? These are the questions. Has this always been the case, or this is something of a new development? If it's new, what are the factors responsible for it being like it's coming up now? How do we handle these circumstances? How do we approach it? Now, if it's not new and that's always been there, we can now review to understand who are this kind of people, what are the circumstances around them acting this way? Do they act this way to just me or to every other person? It can help us also manage how we relate to them. So if, for example, they are acting this way to every other person, then you know that it is not just me, it is every other person. So how do I protect myself from these people? Because it's not about me, it's more about them. So one thing that can help us is set effective boundaries. So I would find the best way to communicate my boundary. And after I communicate it, I'll find the best way. And I'm using the word best way because it can be a bit dicey if the person involved is a superior. So the best way to communicate my boundary. So I'll give you an example when even if it's a superior. I had a training one time and the lady was complaining that it's quite difficult having to talk to a superior when there is a challenge. And I asked her what was the reason. And she said because she feels that the African community, we are not allowed to speak to people that are older than us. So coincidentally, I was older than the lady. So I said, okay, I'm older than you. At the way you would speak to a superior that would seem rude to them. And she spoke to me. And I asked her, without me being a superior, and I speak to you this way you have spoken to me, would you be offended? And she said yes. And we tried to remodernize how she was going to speak to the superior if she had to set a boundary. And it was something that was doable. So these are different scenarios that we can try. So I'm trying to juggle everything because I really don't know which one applies to you. But if we can practice some of these points, it can help us get to a better mental space. I don't know if I'm answering your question, Conrad.
Thank you so much,
Thank
Nonye. I think we would give an opportunity for additional comments once we begin to take the live questions. But
Okay.
let's take one question for Dr. Priscilla, and then we can open it up a bit for live questions, and then come back to the ones on the chat. So Dr. Priscilla, can you please provide examples of how mental health struggles may manifest across various age groups or demographics, and how can parents or caregivers recognize these signs, particularly in children or teenagers?
Noises from.
Sorry about that. Okay, over to you.
Okay, can you please repeat the question because the noises got in the way.
Yeah, sorry about that. Can you provide examples of how mental health struggles may manifest differently in various age groups or demographics? And how can parents or caregivers recognize signs of these mental health issues, particularly in children or teenagers? I just want to mention that after this, we'll take some live questions. So if you have any questions for either Nonye or Dr. Priscilla, please feel free to get ready to raise your hands. But over to you.
Okay, thank you very much. Now, there are different ways children, teenagers, young adults, and even adults themselves can manifest some of these symptoms. I'll start with children. So my kids are within ages 5 and 8. My youngest is 5, my oldest is 8. And I take them to school every other day. So there was one day, one of the teachers was complaining that there's a particular girl in my class. Once they're bringing her to school, the girl will be crying. But if her dad brings her to school, she would not cry. If her nanny brings her to school, she would cry. So she said she's really worried and I should talk with the child. Some other days she would cry that her stomach is paining her. Every day, my stomach is paining me. So getting to talk with this child, I realized that the nanny was doing certain unhealthy things to the child, and the child is beginning to fear that certain things like that would also happen in school. So when they complain consistently, like for the younger ones, that they feel unhealthy, especially when you cannot see any visible sign of illness, or when you have also checked with the hospital and there's nothing really going with them. They talk of stomach pain, they talk of headaches, they tell you they don't want to go to school, they don't feel like going to school, they struggle to even take their bath, that's an example. Now, not being able to finish their schoolwork, like for the teenagers, the secondary, or the high school, the way you may call it, not being able to complete their tasks. When you notice that a child that is doing very well in school suddenly cannot do his or her assignments, suddenly cannot prepare for school smartly the way they would, they take too long, longer than necessary, longer than usual to get ready for school. That could be an early sign. Withdrawal and avoidance. When you notice that your loved ones, especially young children and adolescents, teenagers, are beginning to confine themselves in their room or in a particular place, they are avoiding conversation, they are avoiding eye contact when they're talking to you. Those could be also early signs. So for grown-ups and adults, let's say they might not be able to do certain things, especially the things they usually would do. Example is when you cannot see yourself waking up to prepare meals for your family as a woman, you can't bathe your children, you can't communicate, or you're excessively angry. Even when the children are trying to play with you, you are yelling, you are feeling low, feeling sad for no significant reason, So those are typical examples of how these struggles can manifest from these youngest. So because some people believe that our little ones don't are not exposed or are not in danger of having mental health challenges. But that's not true. It affects every age, every tribe, and every color. So I hope I was able to answer that question.
Thank you very much, Dr. Priscilla. So we'd like to open it up for anyone who would like to ask a question verbally. If you'd like to ask a question, okay. Conrad, I'll just let you, and maybe you can also respond to if the earlier question was well answered. Please proceed, Conrad. You can unmute.
Hello. Good afternoon, all. Thank you for this wonderful webinar, and it's been very enlightening and very, very impactful for me. I have a question actually for Dr. Priscilla, but before I go ahead, I would respond to the posers Dr. Nonye asked. Actually, I've not seen a therapist, but it's just something I felt, and I went to the I had the HMO, and I went to the doctors, but I think somehow they were not able to really fathom what was going wrong. They only told me things I needed to do. Then sometimes I was put on Lexotan that would make me sleep, but it kept reoccurring and it was becoming addictive. And the long and short of it was it kept reoccurring. So I've not seen a therapist. So about the medication, I've only been, I presently am on amlopidine because I'm managing blood pressure. I'm in my late 40s, so it's okay. Then about the toxicity at work. One of them does it in a way that is a little bit primordial, a cunning attitude. It doesn't go direct. So he has like a face-saving attitude. When he's with you, he's all nice and this and that. But I think lately we had an altercation and he said a lot of things, which to me, I felt, I think maybe I'll just bring church into this. The Holy Spirit just allowed it to happen because I never saw that coming. You know, he said a lot of funny things. But the other person is toxic to me and toxic to others indirectly. So those are the two things. And to Dr. Priscilla, please, I would like to ask, being that I'm someone that used to be socially active, but presently I isolate just to avoid issues with people because in my conversations, I bring in a lot of grammar. When I talk about grammar, is that I like to express myself in a very, very modest way. So sometimes I'm being seen as being too overambitious or being too, and I feel sometimes those are scattering remarks, which I feel is not too good. So I try to isolate. I don't say much. I just observe. Then I wanted to ask that now that I'm trying to be intentional, to be socially active, and I know definitely I'll be going to functions, and I don't I've abstained from alcohol. So if I'm going to take wine, because I know definitely there's white wine, there's red wine, and I know that in the Bible it says that moderation is very, very important. So how do I do it in such a way that I don't offend people by checking the wine content before I put in my glass, or how much wine is enough, as in I can say is like a limit, just not to offend people on my table or people in a gathering. Thank you.
Okay, thank you very much. Well, I would say that isolating as a coping mechanism to people's comments in terms of you being expressive is not really a good coping mechanism, all right? Now, the thing is, it's good to let people know your opinion, but of course, in most assertive ways, not wanting to impose or win arguments most of the time, because people feel offended when there's an issue on the table, you want to impose your opinion or use very harsh tones, use not so pleasant tenses when you express. So there's a likelihood that people would feel that you're overdoing it. So instead of isolating, I think you should pick up more assertive skills that will help improve your communication and still be expressive, because if you force yourself to become a quiet person, it's only a matter of time. It means you are storing up what you would have said. And sometimes those situation might set you up for an outburst when there's an opportunity to do so. So my advice would be that instead of isolating, look at more assertive ways of saying whatever you need to say part-time when the need arises. Assertiveness includes stating what you want to say in the best positive ways, tenses, without intentionally targeting the audience or the person you're conversing with to harm them with your words, to demean them, to lord it over them, to lord your opinion over them, to force them to agree with you. State it and be open to other people's opinions. So it comes with some level of flexibility, that there's a fact that nobody has all of the knowledge about everything. Okay, so while you state what you think about a particular topic of discussion, you keep your mind open to other people's opinion. And if there's a need for you to take and add to whatever you already know, or to change your opinion, as the case may be, you can do that. So it comes with flexibility instead of isolating. All right. So talking about wine, alcohol, like the truth is, moderation is key. You know your body, how much of what can tilt you to not being able to function properly. But I usually would advise that when there's need to be around people, especially in the workspace where you need to do some work, you need to be in the best state of mind. And if you know that taking alcohol before engaging in terms of those activities would have a way of either offending the people you're working with or affecting your judgment, then you may have to have a rethink, of course. And you also put your body in consideration. People respond differently to the amount of wine or alcohol, as you may call it, in different ways. So I would say that you should consider, if it's an environment that you know that the people you'll be working with will not tolerate that, you should know that you could do that much later when you're out of that space. But if you're in your private space and you know how much your body can take, considering your own well-being, both physical and mental, moderation is still the word I would throw at you. All right. I hope I was able to answer your question, sir.
Thank you. Thank you so much, Dr. Priscilla. I'll take a question from the chat box and then come back again to a live question. So this is the first question from EC. What are some effective coping strategies for individuals facing job loss or financial instability? So since we still have you on the call, Dr. Priscilla, do you want to take this one? And we'll give Dr. Nonye the next one. Thank you. You're muted.
So sorry about that. If I heard that question correctly or clearly, the person was asking of coping mechanism when someone just lost a job. Was that the question?
Yes, or facing some form of financial instability.
Okay. First on the list, I would say that you would have to, first of all, calm down, okay, and believe that whatever instability you may be facing is a phase, as in PHASE phase. And what happens to phases in life? They pass and other phases come. And just like some of the tips I mentioned in managing our mental health is, what do you tell yourself when you are in this phase? Okay, what are your confessions when you are in this phase? So because it's a phase, you could go by, first of all, telling yourself, keeping your mind in the positive, that, okay, this will not always remain like this. And that is one. Secondly, you would want to spend more time with people who love you, because you definitely need some level of support. Okay, you need some level of support. Now, sometimes we feel that we are good at, we should be the one doing things for people, the savior mentality, carry everybody along. But when we actually need help, what do we do? So it is okay to ask for help, provided it's not a habit, it's okay to also ask for help when the need arises. Because of course, with the knowing that things will definitely change and things will definitely get better. So another thing is try to engage in physical activities, try to get a hobby, or try out something new, learn something new. It could just be something very small that you could start working on that would bring you some earning. Now, I'll give you an example. In 2018, I had to leave my job. I had to resign from the job because I was spending like 60% of my salary on transportation. So it wasn't working. And I had a newborn as at that time, and I had to travel for like 2-3 hours to my workplace. So I had to leave that job. So in between that time, I didn't have any means of income. But this was what I did. A close friend of mine was making peanuts, chin chin, and the likes. And one day I just visited and I saw her making peanuts. Presently, I have a peanut business going on aside from my typical 9-to-5 job. Every other weekend, I get orders, I produce, and I'm selling very well. So you can venture into, look at something you can do so that your mind is focused on something positive. Because of course, if you're having downtimes, you have higher tendencies of thinking in the negative. So those are some little things I think you can do. Tell yourself the positive stories, be optimistic about the outcome of things in the shortest possible time. Engage in physical exercise. It helps to keep both your body and your mind in wellness while those challenges are just there, and they would definitely pass. So remember that it's a phase and it will definitely not remain like that. All right. Thank you so much. I don't know if I was able to answer that question.
Thank you so much, Dr.
Can you hear me?
Priscilla. Yes, I can hear you.
All right.
I think you had the stab.
Oh.
If Miss Issy would like further light being shed on that, please feel free to put in the chat or put the question again. But we have someone with their hands up, Bolanle,
Yes.
so we'll let
Yes.
you speak so that you can. Yes.
Yeah. Good afternoon.
I noticed you also have a question in the Q&A. So if you
Yes, that's the question.
combine both.
Exactly. Because
Perfect.
I think in some cases in Nigeria, if you make a mistake of telling people about your feeling in the office, if it filters to the employer, they will find a way of sacking you, thinking that you are going haywire. I don't think it's advisable to tell them in Nigerian office. I don't know what obtains somewhere else outside Nigeria. Can you enlighten us, please?
So hi, Lois. I don't know if I can take this.
Yes, please.
All right, thank you. Thank you so much, Bolanle. I'm glad this is coming up. I was just looking at this in the chat box and I was just nodding. So two things. The first one is I totally agree with you. You shouldn't be telling an organization that would use it as an opportunity to let you go about mental health struggles. So if you work in an organization that do not prioritize mental health, what we can do is to stylishly let them see the way. I'll give you an example. I've worked with an organization where the person that brought us in for us to be an employee-assisted program provider was actually struggling. So she was struggling and she didn't know how she could tell the organization that this is it for me. So what she did was she tried, push. For the organization to give an approval for a mental health talk to come to the organization. Now, when the mental health talk came, one of the things, especially if you talk to a provider, an employee-assisted provider that knows these things, is to sensitize the organization as well on why they should not. Because you not talking about it doesn't mean it doesn't exist. So we can get them to start having that conversation. Now, secondly, if that doesn't work, I'm still on the organization that doesn't prioritize mental health. If that doesn't work, we can get someone we can trust, that we can speak to about this challenges, this need areas we're currently working with. Another example, an employee of an organization knows that the organization would not accept if they bring this up. So they have a boss that totally understands. So because this particular employee I'm talking about, they find it difficult to get out of bed sometimes, right? So they have a boss that understands. So when that case happens, the boss knows how to cover up for them. And also, she was intentional about going to look for a boss or connecting to a boss that she knew understood. So they were able to get them to cover up for them when the deal was so difficult for them to manage. I think there was a story that also came up with a lecturer as well that gave people that were struggling. It's not the policy of the school, but it gave to people that were struggling extra time for their own costs. So getting somebody within the organization that works, that understands, can help. Now, without having to expose yourself to someone you really cannot trust, because sometimes you will speak to somebody that you think you trust, and before you know it, they tell somebody else, and before you know it, they tell somebody else, and it becomes public news. We would recommend that you speak to somebody that also is struggling, so both of you are supporting yourself. It's easier to lean on somebody that is also leaning on you than leaning on somebody that really has nothing to lose. So looking out for that kind of person can help in order for you to cope with the stress that comes at work. Now, on an individual basis, we can now build coping mechanisms for us to manage on the job. We could prioritize, we could use some of the things that we've talked about. We could identify some of the things that are making us stressed at work, if the work is the stressor, because I've seen people over time that they went into a job free of any mental health needs, and they are on the job with a lot of mental health needs. So it's important for us to be able to identify it. I'm still talking about when an organization doesn't prioritize the employees' mental health. There are a lot of ways in which we can go about it. But one of the things is, if the organization prioritizes, then I'm sure they won't want to let an employee go. Have had bosses that said, now this my employee is struggling, give her some time off, give him some time off. So that would be nice, but not all employers in Nigeria are that way. So if it comes to that, it's important for us to try out some of these tips. There are ways in which we can navigate it. I don't know if I'm answering your question, Bolande.
I think, does that answer your question? I'm sure that Bolande can make a comment if you would like to add anything.
Okay.
Thank you. Just to touch on a couple of the questions in the chat box before we take, I know that there's a hand up. We'll call on you shortly, Barrister Mrs. Obunna. But we have a couple of questions for Dr. Nonye whilst we have you here. How does social media impact mental health, and what strategies can individuals use to maintain a healthy relationship with technology? And in addition to that question, you may have noticed that there was a question that was taken off. So whilst this webinar has been streaming live on Facebook, someone had sent in a comment right on it saying that they had taken some medication that they got off Instagram. So we often see things like that on social media, promoting certain medications or certain things. How do we sift through that? How do we manage that and manage our mental health as we manage social media and technology?
Thank you so much, Lois. Social media, it's the kind of thing we say it's a necessary evil, right? Because it has its own set of challenges. First of all, let's say we leave secondary school or we leave primary school. and we go out into the world, there's a very low chance of us coming in contact with people who have left in secondary school and primary school, if not for social media. So if in primary school or secondary school, I don't know if they do it in night, but you see some people that say least likely to succeed, or most likely to succeed, or the best student. And then if, for example, I am the best student in class, and now that I'm out of school, I look at myself, I'm like, best student to succeed in class in secondary school. And here I am. What am I doing in my life? That comparison has a way of affecting our mental health. So social media is a very large space where we have opportunities to compare ourselves much more than we would if social media was not present. Apart from even people that we know, we compare ourselves to people that we've never met. So we see somebody, an influencer that has their stuff all figured out, and we're like, okay, this person has their stuff all figured out. And we are comparing ourselves to them, and we're feeling bad about ourselves because we see them. So social media has that effect on people. So there was a time, even till date, I see a lot of people, which I'm not saying is not the thing. I'm not saying this is wrong, but with the rate at which people self-diagnose currently is high. And of recent, I'm not going to say high, we have seen, because I've spoken to other professionals, and we've seen more people self-diagnose themselves with ADHD. Where is this coming from? Social media. So notwithstanding, a lot of people may have been left undiagnosed ADHD for a while. We are not taking that away. But with the quantity, it's a lot. In the sense that one of the key things with ADHD is concentration. The truth is, almost everybody you know would not have the best concentration all the time. But there is a clear difference between concentration with a person managing ADHD and a person that is not. But if concentration is a thing I'm struggling with, maybe could be because of my level of depressive symptoms or my level of anxiety symptoms, I want to say is ADHD. And I will take that label and begin to act and do things that I do in order to fix that label. I will say this with all caution. It doesn't mean that there are a lot of people that have not been diagnosed. But with the quantity, people are now self-diagnosing, and just as you mentioned, taking medications that they don't even know if they need, thereby even causing more problems than was already there. So these are the problems with social media. A lot information overload too with social media. One thing I did during that NSAS period was to go off social media totally, because the information you need and the ones you do not need, the ones that are lies and the ones that are true, will be there on social media. So one thing we try to do, I'm stylishly talking about how we can manage it. We can stay off social media. People that know me will be there. There was a time too, social media, WhatsApp is also a social media. There was a time too, I found myself spending too much time on WhatsApp status. I'm like, what am I doing here? Just digesting information. And sometimes when I digest some of this information, I notice my emotions are now becoming off. I found maybe I'm becoming more anxious, more stressed, more sad. And I've been able to link it. So what I do is I muted. So I get not to look at status on WhatsApp. So still with other social medias, we can mute certain people that make us feel certain ways. If you notice that once you digest this person's content, even if the person is giving this content from their best side and there's no ill intention, like for example, a colleague is talking genuinely about something nice, but you feel that every time you look at this person on the social media, you maybe compare yourself subconsciously, and then you feel bad. It's okay to mute the person, even if the person is your dearest friend. You are muting the person because you are not in the best space yet to handle this information. When you are now in the best space, you can now ask them. It's okay. So you mute certain people, certain accounts. If you have to, you unfollow them. If you don't want to unfollow them until you're ready to digest the information. Good thing is social media is helping us out. I think I was scrolling through Instagram one time and I just stumbled upon how you can restrict the time you spend on Instagram. And I tried it out. And I think I put 30 minutes. And after 30 minutes, they said my time is up. I said, I'm not yet done. I was about leaving. They said, unless I go back to the setting to change it, I can't leave. So when I figured that, I had to ask myself, why did I even put this thing? Because the impulse was to go and change it and leave it open or put it longer time. That was the impulse. But then without pause, I was able to ask myself, what was the reason that I put this in the first place? And that reason, I had to say it back to myself, which gave me the strength to leave social media. And after the first few tries, that helped. Once I'm spending so much time, a pop-up comes and takes me out, and I'm out. So these are ways in which we can manage them. I've given to itemize the ways: mute, unfollow people or content that do not make you feel better consistently. Restrict the access you have to some of this information. Also manage information overload by filtering the kind of information you get from social media, because there are a lot of untrue information on social media. So I think these are the 3 points that I've been able to on the spot to manage social media consumption and the effect it has. It increases comparison, increases feelings of depression or anxiety. It also affects our self-esteem, a lot of other things that could come up from social media. It can also give people an avenue to run away from real life challenges. So rather than deal with a challenge in your relationship, rather than that, we go to social media and just keep pressing our phones. It's a very good escape for most, an escape that still brings us back to the challenge when we're done. And I think that answers the question. I don't know.
I think that's been really helpful.
Okay.
Thank you. Treasure, if you do want that, what's the word? If you want her to say more about it, there's a word. Why can't I remember what it is right now? Please, expanded upon. I think that's it. Please feel free to drop a note or something. Okay, let's take a live question and then we'll come back again to the chat, to the Q&A. So please feel free to unmute yourself, Barrister Obuna.
Okay, good evening, House.
Good evening.
Yeah, it is my pleasure being in your midst, and at the same time, I wish to thank the moderator, mostly, and equally our guest, Dr. Nonye, and her colleague, Priscilla. My question is very mild and little and really very, very important. I work with the Federal Ministry of Health. I am the head, the Health Promotion Division in the Family Health of the Federal Ministry of Health. I know that obviously believe that a mental health issue is not an infectious, it's not among the communicable diseases, but non-communicable ones. And in our setting in Nigeria, most people, we know how obviously people live in denial, just like during the HIV/AIDS episode, how people deny, and in other disease conditions, people deny in Nigeria a lot until it gets to a very bad stage. Then I have equally experienced in a setting, worked in a setting where people are very open and they can easily go straight to their condition and own up. It helps the system or maybe their country to manage their situation, or their friends to equally cuddle on with them. And social or stigmatization are not obviously bad over there. But because of ahead to deny even certain situations, they know that even in their lineage, it is there, because this is one of the conditions we know that it is hereditary, apart from the habitual or maybe self-induced mental situation. Now, my question goes this way. Are there ways we can, that is promote or maybe go into that is knitting at the knob by knowing those attitudes or those situations we can, that is nib the mental issues before it arose, to get known to the public or people. Because I believe so many families that know that they have this stress in them, they always deny. They don't like coming up, maybe because of other social issues or maybe isolation within their communities or something of that nature. What are the ways we can encourage people, or maybe we can design to be able to knob that is to cut this mental situation at the nib, that is before it now gets known to the people, or maybe it comes out openly. This is where my concern is always lying, and would like Dr. Nonye to come up with her own suggestion, so that we can, as well as we are going on in our promotion actions or maybe activities, we can now, hold it from that point. Thank you. Over.
Thank you so much, Barrister Ogbonna, for that. Dr. Priscilla, can I pass that on to you to please answer? Thank you.
Okay, thank you very much, Ma, for that. Now, the very quickest way that we can help out foundationally is sensitizing our people. You see, when the HIV/AIDS virus time came in, there was a lot of denial, there was a lot of hiding, there was a lot of secrecy, and then that was the time where the spread was very high, okay, because people didn't speak out. People were denying their status. People were refusing to go and check for fear of what they would see. So my encouragement would be that we can cut this thing before it starts to spread or become worse, starting from our very own families. Okay, I could remember times where in the evenings my mom would talk about HIV/AIDS virus. While I was still in primary, early secondary school, she would tell you, oh, these are the ways people can get it. My mom was actually the person that first told me about HIV/AIDS virus before there was a sensitization program in my school. And then severally in my church, you see programs, dramas, presentations that came on off and on. So if we wait for the government, non-governmental organizations, and individuals to go in the place of sensitizing, it might not go as fast as we would want it, because we would need to manage our mental health and not allow ourselves to suffer to the point of being exposed to full-blown mental health illness, So I would say that let's start with our smallest circle. Let's start with our immediate family. Let's start with our friends. Let's start with our children, okay? Let's start with the people around. Share, we have this thing is us, have this, okay? For not the economic situation, share with people how they can manage their situation so that they don't end up having some of these mental having their mental health or their mental well-being being distorted or tampered with, as the case may be. So sensitization is what I would say, and starting from the grassroots. Getting help early. Now, there are several symptoms. I don't know if you were present when we did some of this presentation. There are early signs of the onset of our mental status not being stable or threats to mental health. Some of the early signs is not being able to take care of your physical hygiene, not being able to control your mood and emotion, having fluctuating mood every now and then, not being able to complete your tasks, to function well, not being able to relate well with people the normal way you would relate. When you see a disparity in terms of the way you behave, when your thought content is usually in the negatives all the time, when you are sad at one moment and you are happy at the other moment without visible or tangible reasons for these fluctuations, those could be early signs. So what do you do, especially when you identify these early signs? Get help. Just like physical health issues, when you get little symptoms as little as a rise in your temperature or a slight headache, most times we'll go complain to our healthcare providers. They make us run tests, and then we get diagnosis for what is actually wrong with us, and then we get treatments as appropriate. So I would say that it would be good when you notice that there are these things, especially the examples of the symptoms I mentioned earlier, when you begin to notice that those changes. Don't wait until your mental well-being begins to deteriorate. So let's encourage our loved ones and people around us not to wait until there is a full-blown mental health illness before we start running from pillar to post to look for who would help us. And because when it gets to that point, that's where people begin to hide, people begin to shy away from letting others know that this is their challenge. So let's seeking help will start with going to a professional. You know, just like physical health illness, people are found of self-diagnosing, and they end up taking medications over the counter that has proven to put them in very, very risky health states. The same thing, self-diagnosing as far as mental well. So if you're not sure of what is really happening with you, or you want to lead a more healthy life in terms of your mental health, you can reach out to any mental health service provider and get appropriate assessments done. Proper care will be given as it is expected, instead of assuming or hiding or all of the things that we are found doing most of the time. The truth is, people are beginning to come to terms with the need of taking their mental health more seriously. I would say that the level of improvement is really going up, but of course we can do better when we sensitize our people the more, starting from our homes, our friends, and our close relatives. Thank you so much. I hope that is able to answer your question, ma'am.
Yes, very much and very well. Thank you very much. But I would also like that you, for instance, your organization, your friend, that is those of you working in this space, you can as well, that is reach out, so that we can also, what our, that is our institution, especially Federal Ministry of Health, in line with our Ebola coordinating minister and the present governance, what they're trying to reach our communities to the extent of, that is promoting every aspect of our health. That is in Nigeria. That is among our communities, up to our ward levels, to make sure that our people were healthy. That is for the well-being of Nigeria. So all of you that are also in this area can reach out, so that we put ourselves together to design activities that can help our people in detecting all these, early signs, because we know that our problem in Nigeria is quite enormous and denial. Even sometimes when you see those people, they will now target to spiritual something that it is from their village, is from there. But when we all come together, I think we will achieve more. So we look up to seeing you guys in a more glaring ways. Thank you very much.
Thank you very much, Tuna.
Thank you. Thank you so much. We're running short on time, so I'll just question a sort of questions we talked before. I think once for you, real issues of as part of would people be even for the amount of alcohol before being served. This is especially in social functions. How to what's the best way to get help for depression? And one question that was dropped in the chat box, but again was quite similar to the question we had touched on regarding the workplace. Mental health issues are often acknowledged in extreme cases only. How do you seek a leave of absence from work for depression or symptoms as explained without being labeled as a mad person? So I know we've touched on these a little bit, but I think that if we can just touch on this finally to round up the Q&A, that would be very helpful, Dr. Priscilla. So if you can take us through those three sort of repeat questions from previous conversations, and we can call it a wrap on the Q&A after that. Thank you.
Okay, in between your questions, the network was a bit cracky, but I think I was able to hear when you talked about amounts of alcohol or something, that does one need to take permission on the amount of alcohol they take in a function? Was that what you said?
So I think the question is, would people be offended if you keep asking how much alcohol content is in what you're being served at social functions in order to manage their alcohol intake? How do they also actually get practical help for depression? So if someone here is actually depressed, how would they ensure that they actually get help? And the last one was more on the workspace. How do you get a leave of absence from work when you have some level of mental health issues without being labeled a mad person, seeing as we had already discussed what it can be like in today's workspaces in Nigeria?
Okay,
so
okay, thank you. Yes, that's
clearer?
fine. Thank you.
Awesome.
Thank you so much. So I'll start with the alcohol topic. Now, it's important you know the environment where you are. Sometimes it would help you become more informed on things to do, things not to do, what to say, what not to say. Okay. So if you're not sure of how people would feel, whether offended or not, by asking, you can just also alternatively not even engage. Okay, because if you're not sure and they're not comfortable with you asking, or they might get offended, or you're not even sure of how they will feel, you can take something else that is available, which is not alcohol, if you're not sure of the amount of alcohol content that is in a beverage that is being served. So alternatively, you could just take something that is available, or totally not take, if that's the only thing that's available, if you're trying to maintain some level of moderation. All right. So practical steps to help manage depression. Remember, I mentioned that tops on the list for any form of mental illness or mental health to start to set in is what you tell yourself. What are your thought contents? What do you believe? What do you see? How do you interpret what is around you? So if you are always dwelling on the negatives, there is every possibility, there's high tendency that your mood will become low. If you are always looking out to compare, oh, have I gotten to the point where I'm supposed to be? When you're comparing with others, there's a tendency of becoming depressed when you compare and you find out that you're not meeting up compared to the standards that you give yourself. So practical ways of of helping people cope or prevent themselves from getting depressed or even managing depression. Keep a positive mindset, positive self-talk, okay? Positive self-talk, words of affirmation that are founded by positive thoughts have been found to be helpful. So it is good that you screen your thought content. If your thought content is usually pessimistic or negative, if your projections are usually not so positive, then you would have issues managing your mood, and you have issues managing depressive symptoms and even depression itself. So challenge the thoughts that come to your mind. If they are negative thoughts, replace them with positive thoughts. Replace them with positive thoughts. There's something we call thought stopping and thought switching. For instance, if you find yourself, if you're managing depression, if you find yourself thinking a particular thing that can make you feel sad, immediately you identify that you're thinking something that is not positive, you stop and replace it with a positive thoughts. Okay, so for instance, if you have told yourself something negative, like, oh, I am not productive, for instance, or I am not hardworking, you could replace it with immediately, not later, immediately replace it with, I am trying my best and I can do better. So positive replacing negative thoughts is a good way to manage depression. Now, spending time with loved ones is for support is a good way to manage depressive symptoms, because of course, when you feel low and you're within the people that you're around, people who love and care for you, there's a lot of support that you get from them, and then you'll feel better. So how do you get permission from work when you're having a mental health illness without telling outrightly that you need to go for treatment for a mental health illness? Okay, I've been managing someone in one of the places that I work, and then she needed to be on admission in the hospital for a mental health illness, and she was concerned that if she told her workplace that she's going to be admitted for mental health issues, she's going to lose her job. So the organization had to write a letter, as a helper to write a letter, or guided her to write a letter that says, oh, this person is not feeling well. The mental illness was not stated. This person is not feeling well, and she would be away from work for this period of time because she's under treatment. So it shows that you would be able to get this permission. You can write that you have a health challenge and you want to tackle it, and you need urgent attention. They would not refuse you, but it is not necessary that it's order and I need some time off, so you don't have to go with the details, all right? So I think that's how we can get our leave from work to get necessary help or necessary intervention when the need arises. Thank you. I hope I was able to answer those 3 questions in one.
I think you were. Thank you so much. I think one of the questions was asking about where maybe they can get help for depression, and I think that you've said in the course of this event that people can reach out to 360 Psych to get more information. So that's one way, and we just want to say a huge thank you to you, Dr. Priscilla, as well as Nonye, for your time today. I know we've shot by 3 minutes. I'm sure everyone here will agree with me that this has been a deeply, deeply insightful session and a very helpful and interactive one. Thank you for the time you've taken to answer all the questions that have come up. Thank you for just going through all of this with us. We're really grateful. Can we just put a thank you in the chat or a hand clap just to really appreciate Dr. Priscilla today and Nonye for their help and for their exceptional training today, as I'll call it. Thank you, thank you, thank you. We will be calling this session, coming to an end of this session. We just want to remind you that this has been brought to you by Pistis Foundation. This is one of many webinars that we do. We try to do this quarterly. So if you're not following us on Instagram, Facebook, Twitter, LinkedIn, please do that. We're Pistis FDN. That will keep you updated on the future webinars that we have so that you can join in. If you're also not following a 360 Psych, you can also follow them on all the social media. And of course, you can reach out to them and engage with them directly if you would require any additional help with anything that you might be facing that you may not have felt comfortable to talk about in this meeting. Thank you once again for your time. Also, check out our website, pistisfoundation.org. It will give you a sense of what we do beyond our health, our education and shelter programs as well, and provide you with opportunities to get involved if it's something that will be of benefit to you. So thank you for your time. Thank you, Dr. Priscilla and Nonye. Have a wonderful weekend and the rest of your Saturday and weekend. Goodbye, everyone. Thank you.
Thank you, everyone. Goodbye. Bye.